Bismillahirrahmanirrahim. Today we will have case quiz number 6. Case data: 46 years old female. The onset of the complaint is insidious. The patient have constitutional symptoms of fatigue and exhaustion and inability to work, with pain all over the body and poor sleep. Musculoskeletal examination: the patient have long history of muscle pain with mild tenderness of the upper and lower limb joints, with no definite arthritis and good muscle power. Other systems show primary infertility of 10 years duration. Laboratory investigations show hemoglobin normal, white BCs normal, platelet normal, creatinine normal, ALT and calcium normal, CBK normal, ESR normal, CRB negative, rheumatoid factor negative, anti-CCP negative, so everything is normal, ANA negative, anti-double strand DNA negative, X-ray of hands and feet are normal, and abdominal ultrasound show bilateral polycystic ovary. This is the only positive finding. So what is the diagnosis? The answer is, again, it is one of the straightforward cases. There is no it is not rare syndrome or somewhat. The answer is simply yes, you are correct. You are right, yes. The answer is fibromyalgia or fibromyalgia according to the accent. Fibromyalgia: the patient has chronic pain, fatigue, and soft tissue tenderness in the absence of clinical or serological evidence of inflammatory disease. The likely diagnosis is fibromyalgia, a non-inflammatory syndrome of unknown etiology until now. Characteristic features of the condition are diffuse pain, non-restorative sleep. The patient wake up fatigued and exhausted after sleep, so the sense of fatigue or tiredness is not relieved by rest or sleep, and there are trigger points of hyperalgesia, pain amplification. The symptoms tend to be chronic and are often present for months before patients seek medical advice. In addition of these classic symptoms, patients may complain of arthralgia, morning stiffness, depression, paresthesia, and even Raynaud's phenomenon. The diagnosis of fibromyalgia depends on many types of criteria. Here we mentioned the old 1990 criteria. In fact, there is another new criteria 2010 revised in 2016 for the classification of fibromyalgia. We all know that there are no diagnostic criteria in rheumatology until now. All we have for all diseases are classification criteria. Since the differential diagnosis of fibromyalgia encompass inflammatory joint and connective tissue disease, a limited screening set of investigation is appropriate, but the difficulty is deciding when to stop. The batch of investigations listed above effectively rule out the most common diagnosis, and therefore this patient doesn't require further test. Although primary fibromyalgia is non-inflammatory and therefore associated with normal investigation, but secondary fibromyalgia is not uncommon in patients with inflammatory disease such as rheumatoid arthritis and SLE. In the 2016 classification criteria for fibromyalgia, the first condition is that any patient fulfilling these criteria should be considered as fibromyalgia unless, regardless the presence or absence of other autoimmune or rheumatic disease. In the past, we have to exclude primary causes to diagnose primary fibromyalgia, but in the focus now is to diagnose and to treat fibromyalgia regardless if it is primary or secondary, because the treatment of both conditions is the same. In these cases, abnormal clinical findings and laboratory tests reflect the primary inflammatory disorder rather than fibromyalgia per se. So if the patient is rheumatoid complicated with fibromyalgia, we can show the full picture of rheumatoid complicated with the generalized pain of fibromyalgia. Management of fibromyalgia has many components. Patient reassurance on several points is crucial. Fibromyalgia is a real disease and they are not mad or making it up, so the patient is not malingering and is not hysterical. The patient have true disease. Although disabling fibromyalgia is not destructive or threat to long-term health. Although many of the symptoms can be treated pharmaceutically, self-management is very effective and they have considerable control over the condition. A combination of patient reassurance, education, graded aerobic exercise, and the management of sleep disturbance can be very successful. The most common pharmaceutical intervention, which cover many of the components of treatment listed above, is the low-dose tricyclic antidepressant such as amitriptyline. If side effects as dry mouth or drowsiness cause problem, selective serotonin reuptake inhibitors may prove to be beneficial. Key points. Fibromyalgia is a non-inflammatory syndrome characterized by chronic pain, poor sleep, and low mood. It commonly coexists with inflammatory disease such as rheumatoid arthritis or systemic lupus erythematosus. Patient reassurance is a critical component of therapy. And finally, thank you very much for your attendance, and we will meet you tomorrow or next time with case quiz number 7. Wassalamu alaikum wa rahmatullahi wa barakatuh.